Hello, my name is Jorge Camacho. I'm a board certified pulmonologist in Gainesville, Florida, and I work for SIMEDHealth. It's a long-term lung condition associated with persistent respiratory difficulties. It makes it hard to breathe. The reason is that the airways of the lung are damaged and narrowed, often because they have been exposed to harmful substances. Cigarette smokers, either current smokers or patients with a history of smoking in the past. Also, patients that are exposed to significant air pollutants, either indoor pollution or outdoor pollution, as well as patients with exposure to fumes or significant dust. There are also other lung conditions that are associated with COPD, such as chronic asthma, or also diseases of the bronchial tubes themselves, like bronchiectasis, also patients with genetic predisposition. Usually, shortness of breath at rest or with exertion is very common. Also, what we call chronic bronchitis, which means a chronic cough with excessive mucus production. There is also wheezing associated with that in certain patients, chest tightness, and chronic fatigue. We ask the patient to inhale deeply and then exhale into a tube that is connected to a machine called spirometer. We measure the amount of air and how fast is exhaled, and then we compare the value that the patient gets to normal, and we assign a percentage, which is the severity, and that would guide us in treatment and prognosis. We have inhaled medications that are really the mainstay of treatment. They have specific indications depending of the severity of the COPD, as well as physical therapy and pulmonary rehabilitation that increase the patient endurance and education as well. In selected patients, we also can recommend evaluation for lung transplantation. It's quite important also to use vaccines to prevent COPD exacerbations that include all the indicated vaccines against influenza, pertussis, COVID, shingles, and pneumococcal pneumonia. The symptoms that are most important to evaluate include shortness of breath that is not well explained and affects the quality of life and daily living. Also a cough that is not well explained, chest pain, and also coughing of blood. Those are the symptoms that I consider will require evaluation.